E-cigarettes is a major epidemic right now.
The number is 3.6 million kids currently using e-cigarettes.
And an overwhelming number of them using liquid nicotine flavors that are clearly designed to addict children.
The AACR is very concerned that the sleek design and appealing flavors of the latest e-cigarettes on the market are leading young people down a dangerous path of nicotine addiction and then to take up traditional cigarettes.
I was governor when we got the news that our youth smoking rates were less than the national average. And for a state that is a tobacco producer with such a tobacco history, we celebrated that day. How horrible it's been in recent years to see the progress we've made in Virginia and elsewhere dramatically turned around. So much progress lost because of e-cigarettes and vaping.
We're thrilled that AACR is putting on this briefing. With new and emerging technologies like e-cigarettes, we have more questions than answers. Questions about what's in the products, what gets delivered in the products, how are the products being used.
Flavors are a huge reason why youth are attracted to these products.
One of the flavors that they're selling for e-vaping, Jam Monster. Can you legitimately make the argument this is so adults can stop smoking?
Things like dragon's milk and unicorn puke, and I have no idea what some of these contain.
My favorite and the most insidious, this one, lung candy.
While many of the flavoring chemicals are safe to use in food, there's not evidence that they're safe to be inhaled.
So I'd like to say that the advertising will bring a horse to water, the flavors get them to drink, and the nicotine keeps them coming back for more. A recent internet survey found that about 2/3 of kids who use Juul did not know that nicotine was always in those products.
During adolescence, the brain is undergoing a lot of developmental changes, and exposure to nicotine during this period can change how the brain grows.
Kids are walking around with this cost-free mentality. They think that e-cigarettes are harmless. They assume that the products don't contain nicotine. 99% of them do.
Youth know and accept the negative consequences of cigarette smoking, but studies show that young people hold far fewer negative beliefs about vaping. They often think that e-cigarettes are not harmful at all, or less harmful than a cigarette.
We know that they're very discreet, they can be used in school settings. We've heard reports across the country of kids using these products even in classrooms.
In 2018 alone, we had a 120% increase in school-reported tobacco incidents.
Youth are using multiple times a day. Some youth tell us that they go through an entire Juul pod in one day.
The 59 milligrams per milliliter that's in the Juul pod, that's roughly the equivalent amount of nicotine as 20 cigarettes.
Educate families and teachers on the signs, what it looks like.
Craving, feeling anxious when you don't have your e-cigarette around you. These are all things that kids are reporting. And these are very classical symptoms of behavioral addiction.
We need research to understand how to help youth who are currently experimenting with these products and finding themselves addicted or already in the throes of an addiction.
These interventions need to be developed well and provided in venues that youth can access, like schools and pediatricians' offices.
I thank AACR for sounding the alarm on this public health crisis. Congress should immediately raise the federal tobacco age from 18 to 21, and as I said, that is a bipartisan consensus. This alone will not solve the e-cigarette problem.
AACR and others have raised some legitimate concerns that we need to be very focused on as we move through this process. First, on the first 4 provisions of the bill, age to 21 for every product, no exception for any population, no preemption of states. AACR said we support the bill. Don't let those things get watered down.
We want to prevent use of these devices, we want to promote research, and we want to help our legislative officials to research and to help combat the use of these devices.